Our speaker today is Dr. Stephen Press. Dr. Press was the first DC accepted into the postdoctoral course in bone and joint disease at Johns Hopkins College of Medicine, and subsequently became the first and still only DC to achieve the rank of Fellow in the American College of Sports Medicine. In 1987, Dr. Press, as chairman of international affairs for the ATA Sports Council, founded the International Federation of Sports Chiropractic, known as FICS, and was elected its first president. He also founded the International Academy of Olympic Chiropractic Officers, IAOCO, for which he still serves as chairman. In 1991, he was appointed by the Minister of Sport of the USSR to be their chief physician at the 16th Winter Olympic Games in Albertville, France. More recently, Dr. Press, together with his son Robert Press, founded wikichyro.org, the comprehensive chiropractic answer to Wikipedia, and he was named Executive Technical Director by the Chairman of the Board of Directors for OurMed.org, created by Columbia Medical School professor Stan Kepnowski. Please help me welcome you, Dr. Press.
Thank you, Chip. Technically, the 510K calls it a TENS device, but it's anything but an ordinary transcutaneous stimulator. Obviously, you cannot put, and I think I said that, don't put a transcutaneous stimulator across your head. What can you treat with the Fisher-Wallace stimulator? You can treat systemic and local pain. You can treat migraine headaches and other forms of headache. I've successfully helped patients with cluster headache and other forms of headache that were refractory to chiropractic treatment and other methods of treatment, and that was successfully treated with the stimulator. For treating of depression and the consequent complication of depression, frequently complication of depression, and sometimes a separate condition of insomnia as a result. We'll get into why. And it has other benefits, including the ability to stimulate certain acupuncture points, as demonstrated by Dr. Kiho Kim. And you can use that to increase DHEA, which has life extension benefits. And DHEA is a precursor to testosterone. The signal is a tripartite signal. It's a triad. The original signal, and there's a 15 kilohertz carrier wave modulated by a 15 hertz, or 15 cycles per second, the bioactive component, and followed by a 500 hertz secondary wave. But what are the changes that we can see? The changes that occur in the use of this device are really quite exciting. In terms of neurotransmitters, serotonin increase has been proven to increase in both plasma and cerebrospinal fluid. Beta endorphin, which for those of you who may not be biochemists, is a natural opiate, and in fact it reacts in the body to anti-opiate drugs like Narcan, which is used to bring people off of heroin and morphine addictions. And if you raise endorphin and give people Narcan, the pains come back. So it raises endorphin in both plasma and CSF. Tryptophan, interestingly, decreases, and you would expect that, but it had to be shown that it occurred. Why would you expect it? Because there's an electrochemical reaction in the body in which tryptophan, which everybody knows comes from, we all know there's some of that in turkey and other things and other foods. It's an amino acid. Tryptophan is converted by an electrochemical reaction to serotonin, which is the neurotransmitter used in the brain, and which is one of the things that's used as a mediator of sleep and is involved in and usually deficient in depressives. So cortisol decreases, adrenocorticotropic hormone increases, gamma aminobutyric acid increases, and by the way, this was a last-minute addition to the slide. I noticed that there was some papers that had shown that both GABA and monoamine oxidase were found to have been increased in platelets as a result of the use of the device. Implications of these things are that, of course, for serotonin is that it manages mood, pain tolerance, symptoms of insomnia reduced, and some control over cardiovascular issues, especially tachycardia and related conditions. Beta endorphin is an endogenous morphine. We've said that already. Tryptophan to serotonin. Cortisol will decrease when it decreases because of systemic relaxation. ACTH, control of hypothalamic and pituitary axis. GABA is a neural inhibitor and involved in reduction of spasticity. So that's probably, it's probably the GABA changes that are involved in the treating and that are helpful for the CP kids. In terms of pain, the goal, of course, is raise endorphins. There's also, locally, as a result of the pain gate, the spinal pain gate mechanism, we can raise enkephalins, which are a very closely related molecule. Been numerous studies on this. I've just quoted a couple of the most prominent ones. It's never ceases to amaze me that this thing has remained such a secret in the health profession. It's like the best kept secret in electrical medicine. And I think we're here to try to change that.